In a couple of minutes, we have that trivia question for you. But right now, we want to say good morning and welcome to the show. On the phone line, Emergency Management and Safety Project Manager from Maui Health, Jeremy Cooke. Good morning, Jeremy.
Good morning. Thanks for having me.
Thanks for joining us this morning, taking the time out. Jeremy, we're in an emergency right now with the fire here in Wailuku. How does Maui Health prepare for emergencies and what are some key components of your emergency management plan?
Yeah, so we develop a pretty robust and complex emergency operation plan that essentially includes strategies for how we'll respond to emergencies. To ensure that we have our ability to sustain operations no matter the emergency. Some of the key critical components of our emergency plan address 6 critical areas, which are identifying those risks, having communication plans for both internal and external operations so that we have the ability to communicate with not only members of the community but within our own staff and with our response agencies. As it relates to the clinical and support activities, we want to make sure that we have resources available for a prolonged period of time so that if there is a disaster or an emergency, our hospital can self-sustain without support for a number of days so that we can respond to the community needs and ensure that we have essentially the ability to continue patient care for those that are in our facility, but also provide medical care for those that might be seeking medical treatment.
I'm sure it's a huge undertaking preparing for emergencies. Jeremy, with hurricane season right around the corner, in fact, it's upon us already, what specific steps does Maui Health take to prepare for potential hurricanes?
So each year we essentially take our plan that we have for our hurricane response and we validate all of the information and make sure that our hurricane response plan is relevant and allows us to be able to respond in the manner that's needed. Some examples I can provide are validating our contacts for our emergency supplies, such as our fuel depots, our water department, to ensure that we have sustained water. Essentially, we stock up on medications, especially before a potential storm has an impact. So we activate and start preparing our staff, start preparing our facility, and pushing out and working with our external partners to make sure that members in the community are also prepared for what potentially might come and potentially impact us.
Yeah, for sure. Like I said, a lot goes into the planning for the emergencies. What tips can you give us, especially those who are dependent on like medications or medical equipment for hurricane preparation?
Yeah, preparedness is key, especially if you're relying on power, water, or internet for life support. A huge thing that most people should equate in their plans, if they are reliant on those for either keeping their medications refrigerated or having power to sustain devices that are needed for medical support or life support, is addressing that in your personal plan. I recommend highly, if you're relying on those services such as power, that in lieu of the new public safety and power shutoff plan that HECO's pushed out, that you go to HECO's website and sign up for their medical needs and communication form, which basically allows you to get advance notice of any anticipated power shutdown. But basically, everybody should have a plan.
Yeah.
And within that plan, they should have an emergency kit, contact information, and a location where if communication fails, that they can meet up with their family members.
Yeah, exactly. Planning ahead is always crucial and is key. Jeremy, thank you for joining us this morning. We'll talk again and have an amazing day, all right?
All right. Thank you. Have a good one.
Aloha.